Next definition, weaning. Weaning is defined as the systemic process of introducing of suitable food at the right time in addition to mother milk in order to provide needed nutrition to the body, according to UNICEF. It means weaning is the systematic process or time period in which the baby's body requires more nutrition rather than the mother milk to maintaining proper growth and development. It is instructed to the mother up to 6 months baby should intake only mother milk. After that, weaning started. Next, what is diarrhea? Diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or more frequent passage than is normal for the individual. Diarrhea is the passage of loose or watery stools at least 3 times in a 24 hours period. The consistency of the stools rather than the frequency is most important. Next definition of Hirschsprung disease. Hirschsprung disease is a congenital anomaly of the large intestine. It occurs due to failed migration of colonic ganglion cells during embryonic development, resulting in absence of ganglion cells in all or part of the colon, leading to functional colonic obstruction. It is also known as the congenital megacolon or aganglionosis. Hirschsprung disease, this is an congenital anomaly where there are the normal migration of the colonic ganglion cells during embryonic development is not occur properly, and absence of ganglion cells in all or part of the colon, which is cause functional colonic obstruction, which means normal peristalsis movement of the colon are disturbed. Another definition is Hirschsprung disease is a disorder of the gut caused due to congenital absence of ganglion cells in the submucosal and meiotic plexus of intestine. It is also known as megacolon or congenital aganglionic megacolon. Next definition of pyloric stenosis. Pyloric stenosis is defined as narrowing and obstruction lower portion of the stomach that prevents food from moving from the stomach to intestine. It is caused due to hypertrophy and hyperplasia of circular muscle of the stomach. It means the lower portion of the stomach, which is called pylorus, are hypertrophy and hyperplasia, which cause narrowing the passage of the food, which is called pyloric stenosis. Next definition is tracheoesophageal fistula. A tracheoesophageal fistula (TEF) is an abnormal connection between the esophagus and the trachea. Tracheoesophageal fistula is common congenital abnormality. Tracheoesophageal fistula is defined as congenital abnormal connection between proximal or distal esophagus and the trachea. Esophageal atresia is failure of esophagus to form a continuous passage from the pharynx to the stomach. It means there are the abnormal connection occur between the trachea and esophagus. This is called the tracheoesophageal fistula. Then the definition of cleft lip. Cleft lip is the gap and indentation in the lip or split continued up to the nostrils due to the failure or fusion of the maxillary and medial nasal process. Cleft lip is a birth defect that occurs when the tissues of the upper jaw and nose do not join as expected during fetal development, resulting in a split or cleft in the lip.